Hello, this is student Dr. Gamble calling in from northern Minnesota. 3 weeks ago, I became a third-year student. Uh, in that self, it is a very big transition, both positive, but also scary because we are moving into unfamiliar territory practicing in the clinical setting. Uh, and this really highlights kind of one of my reasons why um, I wanted to do the bioethics dual degree. And that is that you're always going to find um, or you're always going to be exposed or put in a place where you may or may not be the expert in a topic, or you may or may not have any kind of understanding of the patient or the population that you're working with. But that doesn't mean that you cannot care or treat for that patient or that population. I think the bioethics degree really falls or really comes down to giving you a foundation or setting you up as a physician that's willing to understand or willing to move forward and progress and to continue to learn about the differences between how you want to practice and how patients see you as a physician. And an example of that, I would like to say is, I always give this, is that right now, I may have a greater knowledge when it comes to sexual and gender minority affairs and health. However, as a white male, I am not going to have a complete understanding of what it means to be a person of color or a woman in the healthcare setting. And so what the bioethics degree does for me is it gives me tools to seek to understand before being understood and to really put the patient first and allow them a place and a spotlight to be able to address their concerns. And in recent weeks, we've noticed that we have not been giving space and giving a spotlight to certain populations when it comes to decisions. And one of those main decisions is healthcare decisions. And I think this degree will become even more important as we move forward, because we're going to start to dissect and to unwrap some of the problems that we have institutionalized into our system. And the people with training in bioethics are going to be able to take those downfalls or take those errors in our system and to address change and to specifically move forward in a way that's equitable for both providers and patients in healthcare. And I think this degree will really give me a good foundation. It's not necessarily going to be a tool that I pull out of my pocket when I need it and put it away, but rather it's going to define how I practice as a physician or define how I practice as a physician and define how I want to interact with my patients. And at the end of the day, all I can say is that I truly believe this was really the only path into medicine for me. And I truly believe that every student that does decide to go down this path will be more equipped and will have a broader perspective of what it means to be a patient in the healthcare system, but also what it means to the patient-provider relationship and how we can address health, but also address social inequality and address different issues that may not be of clinical lineage. So if anyone's interested in the bioethics program, I really can say is that wherever you are in understanding, it doesn't matter, because at the end of the day, none of us are ever going to have a full understanding of how the world works or how healthcare works. But what we can do is we can set ourselves up in a position that we can address issues when they do arise in a compassionate way, in an appropriate way, and in a way that both benefits a patient, but also population, but also benefits ourselves and our own mental health. Because as a physician, we're not only caring for a specific patient or a specific family, but what we're doing is we're caring for communities, and we're assisting and helping them get to a better place and to feel more comfortable in the world. So I would highly recommend the bioethics degree to anyone who's interested, and hope that we have more bioethicist physicians out there in the future.